a start just following this morning's meeting. Members, this morning's meeting will cover the committee will consider two proposals for statutory rules. The SR 2015-213 time off to attend adoption appointments for prospective adopters, departmental briefing on European policy developments, a departmental briefing on economic and activity, the draft strategy, and a briefing from Assembly Research into the Special Educational Needs Bill. Members, apologies. I have apologies from Phil Flanagan, Pat Ramsey and Tom Buchanan. Is there any other apologies? Okay, members. Members, moving on then, chairperson's business. Just advise members that on Monday morning I met the Minister with the Deputy Chair and the Chair and the Deputy Chair of the Committee for Enterprise, Trade and Investment prior to a statement on the economic and activity draft strategy. So that was covered and we got a pre-briefing from that. Members, also advise you as well, yesterday afternoon a number of members and I met with a delegation from the BITES project regarding the cessation of core funding from the department. Members, the correspondence regarding this is at page 223 and is tabled at page 4. I think the members, Anna, Fra, you were there too. Do you want to say anything?
It's a very good project, and I think it was quite a shock to them. Suddenly, they were told 2 weeks in April, that the funding, had stopped, and so I think we need to be asking the department about the management of it.
Yeah, Fra, do you know?
I think they ask a number of questions, and we should follow through on it. Like, Anna found it strange that the group were told of this very quickly after the financial year started, and this thing usually happens before the financial year. So I think that there are a number of questions we need to ask about it, and certainly for the peace of mind of the group anyway, we need to be getting whatever information we can.
Okay. Members, just to bring you up to date, the BICE project had been Dell core funded for 22 years. On, was it last Monday? They got told their funding had been withdrawn from the 1st April, so it was actually retrospective from there.
Sure, but is that not the case with many groups who are contacting us at the minute? The timing is awful. It's not giving people a chance in different aspects of Dell to make alternative arrangements.
Well, this one seems to be pretty stark as well. There's a number of cases out there, Dave.
And it doesn't all relate to the ESF, to be honest. It's other aspects of Dell too,
Well, they had ESF funding as well, which they weren't successful in as too. So they went from something like 600,000 down to 176,000 of funding. So.
And some of the groups have other options out there, but unless they're signed off on ESF, they can then move forward and seek partnership funding in other places, but they're not getting a chance to get that time.
This came completely out of the blue. So members content that we forward those queries to the Minister?
Yeah.
And I think he is due in front of us next week, so we'll ask him to respond on that. Members, moving on then, draft minutes. The draft minutes of the last meeting on the 25th of March are at page 6 of your packs. Remember, you agreed they're a true record? Agreed? Good.
Yeah.
Sign has been accurate. Members, matters arising at page 14 of the pack. Members, there are agreed action points from the committee meeting on the 25th of March. Members, you agree to the action points as listed? Content? Good.
Okay. Yep.
Any other matters arising? Okay, members, moving on from correspondence in your packs and also table. Members, at page 25 is correspondence from Anna regarding a briefing from NICEM on their Voices of Change consultation. Anna, do you want to supply any further?
Yes, it was research on barriers to ethnic minorities. It's a very good piece of research, and I thought there are elements in it that would be of relevance to the department and the committee, and just wonder would members be happy for them to come to give you a presentation on it. It's about the barriers for ethnic minority people trying to gain qualification, trying to learn English.
Okay. Members content we put this onto our forward work programme? Good. Okay. Members, then at page 79 is correspondence from Include Youth regarding the decision to end Pathways to Success EMA funding. Members, again, I think as Davy was referring earlier on, it's another one of these well-funded projects that Dale just seem to have withdrawn their support from overnight. Now, I did hear, I don't know if you've heard in the radio on the way in, Blair Anderson from Ballymena putting the case to the Minister this morning. I think she made a very strong case for the young people who were on this, and I was glad to hear the Minister actually said in that interview that this matter was still on the table and it wasn't a done deal. So, Fran?
Sure, and again, like Bates, but with Include Youth, because we're all very well aware of the work that they have done. They're no strangers to this committee. They've done a lot of reports, especially on marginalised young people, and is there any way that we can find ways to drill down into why these decisions are being made? I think the annoying thing about it doesn't seem that any of the groups have been taken through or given any reason why this why the process has excluded them, especially given the track record of the likes of Include Youth and the people that they work with.
We have rescheduled the Minister for next week in regards. It was in regards to ESF, but I think we'll be expanding that into EMA for Pathways and the Bites project as well, just so we can actually get, while he's in front of us.
Is there any possibility that we can, and I know that we did get the names of a number of groups that got or didn't get money, but there seems to be more groups popping up all the time. Could we get a list
of the department just to, members content with that approach? Okay, members, thank you. Members, tabled at page 10 is correspondence from Bryson Cairn. It was actually sent to the committee, but I think it's a problem they seem actually to have with me rather than the committee. It's a question I asked to the Minister in regard to funding he'd provided to the NEAT Forum of 108,000 at the same time he was withdrawing it from EMA for Pathways. So they seem to have taken umbrage to the fact that I was trying to link the two funding programmes and have asked for a meeting with me. So members, I think it's about me rather than the committee, so I've agreed to meet them at a stage if you are content with that approach.
Okay, yeah.
I think you need backings.
I'll manage for it. Members, correspondence actions as suggested, agreed, unless indications to the contrary. Are we content? Members, page 24 of tabled papers, there are 7 invitations listed. If members wish to attend any of these events, can you please inform the committee staff who will make the necessary arrangements? Okay, members, moving on, draft forward work programme. Members will note that the ministerial briefing on the European Social Fund scheduled for today has been postponed as per the email issued on Tuesday the 21st of April. Members, it was clear when we met the Minister on Monday, Tom and myself, that the appeals process for ESF applications wouldn't be complete by today and would still been ongoing. So we thought rather than bringing them here while the process was still ongoing that we would postpone. So they have rescheduled for next week, and I think we'll go ahead next week no matter what stage we're at. Members, are you content with that approach?
Yeah.
Members, the reason, and we were supposed to be on a committee visit to Stranmillis College next Wednesday, which is Wednesday the 29th, but I'm sure as members are aware that due to the potential of and possibly an additional plenary session next Wednesday in regard to the reservoirs bill, we thought it would be better to remain in the building. So we rescheduled the visit to Stranmillis for Wednesday the 24th of June, if members are content.
Yes, content.
Okay, members, moving on then, page 235 is the draft forward work programme, which is up until the 1st of July. A revised copy of the forward work programme will be issued to members with the changes we already discussed, and other briefings may be scheduled as they arise. Members content? Okay, members, moving on to agenda item 7, which is the first of the SL1s. As SL1, the student fees amounts amended regulations Northern Ireland 2015. Members, page 237 of your pack. The Department proposes to make this statutory rule to provide for the annual increase using an inflationary forecast of 3.19% for the academic year 2016-17, provided by Treasury, to the prescribed basic and higher amounts of higher education institutions in Northern Ireland may charge to students who are ordinarily resident in Northern Ireland and accepted others. The proposed inflationary increases are in line with the Minister's announcement in September 2011 that following agreement with the Northern Ireland Executive, the cap on higher education fees for Northern Ireland students and accepted others studying in Northern Ireland will be maintained at current levels, subject only to annual inflationary increases. Members, it is proposed that the provisions will come into operation on the 1st of September 2016. This statutory rule is subject to negative resolution. Are members content with the proposals for the statutory rule?
Chair, can we ask the department, will there be a corresponding increase in the level of student finance to meet those inflationary increases?
Okay.
Right. What are we asking for?
Can we
Ask
ask
the department
for
if student finances will also be increased. But can I just clarify, that's a request outside this? Are you still okay to agree the statutory rule?
It's negative resolution.
It's negative resolution.
so-
But are members content with the statutory rule?
Yes.
Members agree.
It's a different SR for student finance.
It's a
All right, yeah.
That's a request following.
Yes. Yeah, that's fine.
Okay. Members, agenda item 8 is the SL1, the Working Time Regulations, Northern Ireland 2015. It's at page 243 of your pack. The statutory rule will consolidate and replace the provisions of the Working Time Regulations, Northern Ireland 98, the 1998 regulations, and the 10 statutory rules which amended from 1998 to 2009. A reduction in the administrative burden to employers will be achieved through the consolidation of a number of separate statutory rules into a single set of regulations. These will make navigation of the provisions of the regulations easier for users. It is proposed that the rule will come into operation on the 31st of May 2015 and is subject to the draft affirmative procedure before the Assembly. Are members content with the proposals for the statutory rule?
Content.
Thank you. Members, agenda item 9 is SR 2015-213 is time off to attend adoption appointments for prospective adopters. Regulations Northern Ireland 2015. Members, page 247 of your pack. The Department laid the statutory rule on the 3rd of April 2015. The committee considered the proposals to make the statutory rule at its meeting on the 4th of March and agreed that it was content with the proposed statutory rule. These regulations extend the right to time off to attend adoption appointments is to approve foster parents who are also approved prospective adopters of a child in certain circumstances. The statutory rule is subject to negative resolution and come into operation on the 5th of April 2015. Are members content with the rule? Members content? If so, the Committee for Employment and Learning has considered SR 2015-213, time off to attend adoption appointments for prospective adopters, Regulations Northern Ireland 2015, and subject to the Examiner of Statutory Rules report, has no objection to the rule.
Chair, just
Anna.
one sentence there. It says the likelihood of a breach was previously communicated to the Examiner of Statutory Rules. So,
21-day rule.
It's the 21-day rule, just it was the timing.
okay.
There's nothing within the content of the rule.
Right.
But,
Okay. Thank you.
okay, members, moving on then, agenda item 10, which is the departmental briefing on European policy developments. Members, can I welcome along Ms Patricia McAvey, Head of European Policy Branch. Members, this will be covered by Hansard. At page 53 is the departmental response to the committee request for further information following the briefing on the EU legislative programme, and at page 257 is the Assembly research paper. Patricia, good morning. You're very welcome. And over to you.
Good morning, Chair. First of all, can I apologise that I haven't prepared anything for the committee. My understanding was, the expectation was that the Minister and other colleagues were coming along today, and so it didn't necessitate a paper to the committee. I'm just going to highlight two major things that the department are currently doing that would be of particular interest to the committee, and then I'm happy to take any questions, Chair. As the committee knows, that the department is committed to supporting the executive in its achievements of its EU targets, and indeed the department is committed to stronger engagement within the EU. Two of the key things that we're currently looking at the moment that will be of interest is the European priorities. The department's contribution to the 15-16 priorities are currently being finalised and are awaiting approval from the Minister. The work is also underway to report on the associated targets for the end year review for the 2014-2015 targets, which has been commissioned by OFM DFM, and those targets then will be updated and shared with the Executive. The other key thing then is the competitive EU funding, and as the committee knows, the target of 20% has been extended in terms of EU funding, and it's been increased to 50% for all departments to contribute to that. And DEL has been a major contributor to achieving the target in the past. Now, the new programme Erasmus Plus and Horizon 2020 are now operational since 2014 and cover the period 2014 to 2020. Initially, when the department was asked for its prediction in its drawdown under the new programmes, we had indicated a dip in the 2014-2015 year. We had anticipated this because the new programme is different from the old lifelong learning programme and the FP7 programme in terms of the criteria, assessment criteria, and in terms of the application process. We have recently looked at the drawdown for 2014-2015 in terms of those two funds, Horizon 2020 and Erasmus+. The initial look at those figures have indicated we've actually exceeded our projection, which is good news. And we think that in part is due to that some of the funding is carried over from the previous lifelong learning programme into the figures for this year. But we also think that it's in part due to the work that DEL officials have done working with the national agency, highlighting and promoting the new programmes, and working internally and externally with our stakeholders to try and facilitate awareness of the programme and support applications. And in relation to Horizon 2020, the infrastructure that DEL supports in terms of the Northern Ireland contact points. Really, Chair, that's all. I just wanted to outline those two major things, but I'm happy to take questions or cover anything that I can.
Okay, thanks. Patricia, the briefing was, I suppose, European matters and the ESF, but when the Minister not been here in regard to ESF. Can I ask just in regard to your role as European Policy Branch, and it's not the current ESF programme, but the previous one, the Minister's indicated at times that the funding for that was stalled at times because of compliance issues. Have you...
That, Chair, I don't cover ESF. Right. I would be EU policy in terms that would have impact on the department, should that be mobility, EURES, that sort of thing. And then the funding that I would be looking at would be what we describe as the competitive funding, which is primarily Erasmus and Horizon in connection with the department. Okay.
Then, in regard to Erasmus Plus, the organisations who will utilise Erasmus Plus, who do you see them being?
Well, in the past, the key, I suppose, beneficiaries directly would be individuals, but organisations on the lifelong learning in the past would have been higher education institutions in terms of support mobility of students, and to a lesser extent further education colleges. But we are now promoting it, and our expectation is that that will increase. Equally, the department is looking at utilising Erasmus Plus in terms of mobility to cover a wider sector, and the department's looking at, for example, in its new apprenticeship strategy, to look at how it can utilise some of the Erasmus Plus funding in terms of supporting mobility within apprenticeship schemes, and indeed wider in terms of any youth provision that will have an element of affording the young person an opportunity to experience a programme outside Northern Ireland. So we want to extend the opportunity to utilise Erasmus Plus to fund and support other programmes.
Okay. Mid-term review of Europe 2020, is that within your...
It is.
Right.
It is. Yes, well, what happens is from the department's perspective, we would get information from various sources, Chair, where we're asked to comment on. Some of the policy areas, we'd get it directly from their policy sources within the UK. The UK government through BIS might come through DFP and ask departments for input, and that's what happened in terms of Europe 2020. Now, Europe 2020, Chair, we have responded at early stages in terms of the mid-term review. We were asked to comment on the view from the UK. The department concurred with the view that the UK had articulated to the Commission in terms of what the focus of the 2020 strategy would be. But we always reserve the right we stated we should not exclude the possibility of Northern Ireland setting its own targets in range of economic and related policy areas because they're devolved. But so we concurred with the UK's view.
Okay. Anna?
Yes, thank you, Chair. You said we hope to increase our target to 50% from 20%.
That's an executive target.
Okay.
Yes.
Okay. I mean, the 20% was obviously far too low. We exceeded it in about 3 years.
Yes.
Before the end of the period. So, in terms of finance, in terms of money, how much extra are we going to get out of the pots of competitive funding, and how they can help the department?
Well, the 50% is a target for Northern Ireland, and all departments will contribute to that target. We have probably in the past exceeded
Yes, we did, of course.
We did, and so how much there is a target of what the 50% is, and to be honest, I haven't got that figure to hand,
Okay.
but I know it's published, and there is a target for Horizon 20.
I think last time there was a dispute about exactly how much you got. Is
Yes,
that right?
yes. But that's why we had indicated we felt there was a dip, but other departments are increasing their drawdown of EU funding, competitive funding. And then there's a new target for the executive set for Horizon 2020 for the lifetime of the programme. And that target will be primarily DETI and DEL. So that is €145 million, I think. Not million, yes, €145 million over the lifetime of the programme. So there has been a slight dip in 2014-15 in relation to Horizon 2020. But the issue is for us then is to review the infrastructure and see how we can support increasing the drawdown. But the department hasn't got under Erasmus Plus a specific annual figure that it has to achieve.
Okay. How many are on the pipeline now with University of the Queen's or Jonathan in terms of using Horizon 2020?
Well,
money?
my understanding is that that the universities still are a significant contributor in terms of the drawdown, and I know that I'm just looking at that currently their performance is slightly less than than the UK and what they anticipated. But my understanding is that they have several major projects in the pipeline that could be successful. So the universities are still a major contributor to the drawdown. The department is actually meeting with the universities in May to see how they can enhance their performance further.
Okay. Thank you.
Okay. Members, anybody else? Okay, Patricia.
That's great.
Thank you very much, and thanks for your time.
Thank you.
Pleasure. Okay, members, moving on then, agenda item 11, which is the departmental briefing into economic and activity, the draft strategy. Members, can I welcome Ms Yvonne Krosky, Director of Youth Policy and Strategy Division, and Mr Rory Muldrew, Economic and Activity Strategy Team. Members' briefings at page 262 is the departmental briefing, and tabled at page 12 is the economic and activity draft strategy. Morning, Yvonne, Rory.
Good morning, Chair. Morning,
Over to
members.
you.
If I may, Chair, I'm just going to run through a wee bit of background, and everybody will be aware that Dale and DETI, through the Programme for Government Commitment, Programme for Government for 2012-2015, committed to develop a new strategy to tackle high levels of economic inactivity in Northern Ireland. Economic inactivity refers to individuals who are neither in work nor actively seeking work, and are available to start immediately. The current rate of economic inactivity in Northern Ireland is in the region of 26.8%, which equates to 312 adults in the age group of 16 to 64, and they're of working age who effectively are disengaged from our labour market. This, when we compare to the UK average of 22.1%, is a difference of in the region of 4.7%. To put Northern Ireland's high rate of economic inactivity into context, the Northern Ireland unemployment rate is 6% compared to the UK average, which is 5.6%, while the Northern Ireland employment rate is 68.6% when compared to the UK average, which pans out at 73.4%. We're very strongly of the opinion that the only meaningful solution to effectively reduce economic inactivity on a sustainable basis is through employment and transitions towards work and support in that regard. Over the past couple of years, we in the Department have undertaken extensive research around economic inactivity. We've had a very detailed consultation process, and this culminated in the development of our strategy, the primary focus of which is obviously to reduce inactivity and improve employment prospects and outcomes for a number of specific target groups. The three target groups that the strategy is looking particularly at are those with work-limiting health conditions. In the region of 27,000 people fall into that category. Lone parents, 22%, and carers, or 22,000 rather, I beg your pardon, and carers 15,000. I suppose it would be very remiss of me not to say from the very outset, our strategy is all about voluntary participation, and I think it's very important that I bring that right to the fore at the minute, so there will be nobody mandated to go on any of these programmes. This is a programme about genuinely helping those who want to work and volunteer to participate. The final strategy was agreed, as you all know, by the Executive on the 16th of April, and indeed our Minister and Minister Foster jointly launched it in the House on Monday. We believe that through the successful delivery of the strategy, we'll really have a genuine opportunity here to make the difference, make a real positive impact on the people who fall into these categories, both economically and socially, to help redress the historical economic imbalance between Northern Ireland and other parts of the UK and indeed these islands. Because when we submitted our paper to you back a few weeks ago, and at that stage the strategy hadn't yet been launched or approved by the Executive, it now is, and been mindful of that, I sort of want to take your views. Would you like us to walk through that, or would you like to move straight through to questions, Chair?
I think, Yvonne, if you could walk,
That's fine.
run through it. How would I run through it rather than
I'll run through. Rory Mulgrew is going to take us through the pertinent points, if that's...
Thanks, Chair. So I'll pick up on the points in more detail that Yvonne hasn't already covered. So in terms of the development process around the strategy, it's really been fairly comprehensive in terms of research, development, consultation. We undertook a baseline study looking at the profile of economic activity in Northern Ireland, and followed it up with an independent literature review carried out by Edinburgh and Napier University. This led to the development of a strategic framework outlining sort of key proposals to tackle economic inactivity, which the Executive noted sort of at the tail end of 2013, and which we undertook an extensive public consultation exercise on. We engaged separately with the local business sector, as a key player really in the delivery of the strategy, and undertook a series of independent focus groups across Northern Ireland with people in the sort of inactive groups that we're seeking to help. Regular engagement with both this committee and the Enterprise Trade and Investment Committee throughout the development process, and indeed with the Executive Subcommittee on the Economy, who have endorsed a number of the strategic proposals which are now in the final strategy, which was agreed last week by the Executive. So in terms of the target groups, we looked through the baseline study at the scope of economic inactivity, and The study recommended that we focus on 3 specific sort of inactive subgroups. So within the long-term sick and disabled category, as Yvonne said, it's people with the work-limiting health conditions or disabilities who, with the right level of support and accommodations from the employer, should be able to work. And then within the family commitments category, the key groups are lone parents, people with other sort of caring responsibilities, who'd be better off in work but are unable to sort of make the transition due to a lack of sort of appropriate support and opportunities. As Yvonne mentioned, the total of these groups based sort of on Social Security data is about 64,000, which equates to about 40% of all Social Security claimants in the economically inactive groups, approximately 20% of the total working age figure of the 312,000 inactive in Northern Ireland. In terms of a strategic goal, strategy seeks by 2030 to contribute towards a stable and competitive employment rate in Northern Ireland, which exceeds the United Kingdom average through a reduction in the proportion of the working age population, 16 to 64, classified as economically inactive. To ensure that the strategy is successfully progressing towards that target, an interim goal has been set to achieve an employment rate of more than 70% by 2020, to really to assess the effectiveness of the strategy's delivery at a midpoint in the implementation process. These goals then are supported by a number of strategic objectives, which correlate to the groups we're trying to help. So, objective 1 is by 2030 to reduce, through transitions into employment, the levels of economic inactivity due to work-limiting health conditions or disabilities, by a 25% reduction in the number of people claiming employment and support allowance in the work-related activity group. And that's against the 2015 baseline position. The second objective is to achieve a similar reduction in relation to lone parents and carers who claim income support, again against the 2015 baseline position. And then the third objective is by March 2017 to establish a robust baseline for the numbers of people moving from work and employment into economic inactivity due to health-related issues, and subsequently by 2030 to reduce this baseline figure by 20% to a reduction in the number of new claims for relevant health-related benefits. We fully recognise that any potential future changes to the social security system in Northern Ireland may have implications for the strategic objectives in terms of the scope, the nature and the claimant count of any new revised benefits. So the strategy will therefore be reviewed and refreshed on a regular basis to take cognizance of any such changes. In terms of the sort of strategic approach outlined in enabling success, based around sort of a model of intervention centred around 6 key themes. So theme 1 is about improving and engagement and support with the target groups, and encouraging and facilitating labour market transitions and improving employment outcomes through an innovative and outcomes-focused competitive pilot testing model. The second theme is about increasing employment opportunities and how we can stimulate job creation through the development of a new model of incentives and support to help people in the target groups to make the transition towards and into the labour market on a sustainable basis. Theme 3 is about addressing wider labour market barriers in relation to older workers and people with mental health issues, basically about changing some societal attitudes and perceptions towards these 2 groups. Theme 4 is focusing on breaking the cycle of inactivity, looking at preventative measures which will reduce future inflows into inactivity, basically through improving health and work outcomes and promoting positive life choices amongst young people who are at risk of becoming NEET and potentially inactive in the future. Theme 5, partnership work and strategic management, tying all of this together through appropriate delivery structures and sort of coordinating and monitoring functions. And theme 6 is about improving our information base and our data sources to inform the effective delivery and monitoring of the implementation. The strategy proposals to implement the themes through a series of 11 projects will be taken forward by a number of executive departments. Project A, which fits in with Theme 1, developing an outcomes framework based on a co-design approach with key stakeholders and the target groups to form and guide the pilot testing process, which is Project B. Both of those will be taken forward by DEL. Project C is a geographically focused sort of control group project, which will be developed, delivered and evaluated, sort of test new approaches in an area of high activity, and it will also provide valuable benchmarking data for Project B. DSD are going to lead on that. Under Theme 2, Increasing Employment Opportunities, DEL is going to develop a new model of support and incentives to encourage employers to hire and upskill people from the target groups and to promote sustainable employment. Project E, taken forward by DSD under the Theme 2, is about improving sort of transitional protections to help people to make the transition when they opt to do so from perhaps the social security system into the world of work. So we're going to look to see how we can do that more effectively. Under Theme 3, and addressing wider barriers, DEL are going to put in place some new measures to highlight the benefits of older workers in the labour market, including an age-positive public awareness campaign and to promote age-positive recruitment practices. Also under that theme, Department of Health are going to put in place a new mental health promotion strategy to encourage positive mental health through working in the workplace, as well as initiatives to support employers to foster mental health friendly workplaces. Moving on to Theme 4, which is breaking the cycle of inactivity, Health are going to establish a sort of independent expert panel to look at a number of sort of health and work recommendations that have been put forward independently by Dame Carol Black, and to look at other options and feasibility around other ways to sort of better integrate and improve health and work services and outcomes in Northern Ireland. Project I, under the same theme, is we're going to appoint a series of regional younger people's advocates to work with young people at risk of becoming NEET and hopefully inspire and promote positive life choices amongst the young people. Theme 5, Partnership Strategic Management. DEDI are going to put together a sort of an external strategic forum, which is going to comprise employers, vulnerable community sector, central and local government, healthcare sector, and other sort of relevant bodies and expert advisors as required to provide strategic oversight and leadership throughout the implementation of the strategy. And then Theme 6, Project K is going to, DEL and DSD are going to undertake a number of research projects to inform a sort of improved information base. In terms of funding, I've been very acutely aware of the context of constrained public expenditure going forward. Throughout the development of the strategy, so we're proposing that a number of the projects will initially be piloted, ensure that effective solutions are identified prior to any upscaling of investment. For this reason, a number of projects will initially focus on feasibility and scoping exercises to provide modelling to inform future viability, costs and benefits. As the projects are developed, specific SMART targets will be established to allow accurate measurement of progress, and we would hope to start all projects as soon as possible when adequate resources have been identified on a cross-departmental basis. Thank you.
Okay, thanks, Rory. Okay, I suppose just a couple of questions. I know there's the phrase new is used in regard to a number of the projects. Are they really new, Eva?
We believe this to be a very innovative approach, and we're starting from a baseline that we actually are starting to bring in and test new pre-commercial procurement to really look at, and we're looking at the very bottom-up approach, and we're bringing in experts. Indeed, we have. In fact, for one of our groups we've already established for Project A design team. We see this as a very different approach. We are very mindful that we have tried to help many of these groups before, and this time we really would like to try and get it right. That's why we're starting at a small scale. We have, for example, NESTA, the National Endowment for Science and Technology and Arts, represented in our design group, indeed with that established. Again, with the Young Foundation, Edinburgh, Napier University is also going to be in the design group. So we believe it is very different. We're really starting at a small scale, and we're going to be testing out different models in different geographical areas. No one size will best fit in Northern Ireland. We know that the statistics very clearly tell you that there's different pockets and different issues in different communities. So we believe this is different. This is not the civil service coming with a fixed approach. We will be looking at the outcomes we want to see from the projects, but we have no fixed idea about the howevery, how we get there. So I do believe it's different, Chair.
I'm trying to tease out, that's the difference you see in this programme.
It is.
For us, before, the department would have come with a Northern Ireland agenda, a Northern Ireland programme that hasn't worked. And I'm thinking about people with mental health issues, re-engaging the elderly in the workforce. Is the newness of this that you're going to actually focus it?
Well, from two perspectives. One department doesn't own this anymore. The executive owns this strategy, and every key department from health, all are working in partnership and own these projects. And they will come at this looking at different issues, looking at obviously mental health, which is a very big issue in Northern Ireland, really looking at how we break down the barriers, how we get older employees back into work, how best to support them, looking at how we might incentivise, and we might incentivise different for different groups. So we're very firmly of the view that this time it is very different, and we're bringing in international expertise to really help in terms of that thinking through the design group as well at the very start.
Would it be helpful, perhaps, Chair, if I outlined to members the process that we're, the model that we're going to follow for this innovative?
I have a number of questions starting to build up, Rory, if that'll maybe develop through that.
That's okay.
If you're all right with that. In regard to some of the specifics of the project, Project E, raise awareness levels of transitional benefits protections and better communicate the linking rules to reclaim benefits to encourage labour market transitions. Is that really the department saying, we'll show you where to get benefits so you can enter low-paid jobs or zero-hour contracts but protect your benefits?
I think whenever we looked at this with DSD, certainly my take on it with a relatively fresh pair of eyes, where there are a number of existing protections that exist for people who are moving from certain benefits into the world of work to help facilitate that. And it certainly appeared to me that some of that could be better communicated. There seemed to be a sort of an awareness issue, perhaps with some people not realising that there were some protections that could be afforded to them to help them make the move from Social Security into work, such as the extension of certain benefit types for the first number of weeks whilst in employment.
I think a lone parent's a good example to use. The fear of losing one's benefit if one dips one's toe into the labour market is such that this project will look at how we support that person and say, you can do this and you can test out work, and we have protections we can put in place that you won't lose your benefit or that you won't have to make a fresh claim. And I think that's really what we're talking about at a very basic level. It's about taking away that fear factor, that you're not pulling the carpet from under the person's feet, that it's okay to try this, but if it doesn't work or you can't manage the hours, we're not taking away your benefit. And we're also looking at communicating better through DSD. We'll be looking at communicating much better about here are other things we can do to support your transition as well, that it's not moving from A to B with nothing in between.
One of the very real fears that were communicated to us when we met with our focus groups and indeed people from the groups that we're trying to help, was the majority of people that we spoke to wanted to work. There was a real fear of having to sign off their benefit, and then if the employment did not work out, they were back to square one in terms of a fresh claim. So, the project is really about to see what sort of new protections could be put in place to help solve those issues.
See, according to the timeline, that's not even due to kick off until the start of 2016, so it's even well down the line at this stage.
That project doesn't kick off until next April, Chair, that's correct. And in between there will be some work carried out in terms of looking what exists at the minute. So there's a third piece needed here. It's not just about taking what we already have, it's looking at is there more we could do here as well. And we're confident that project will actually look at what the fear factor is for a lone parent or someone, for example, with a mental health issue, that they feel that they are being protected and that they are not disadvantaged if they move off benefit and it doesn't work.
Yeah. Project I then, and I'm concerned, it really has timelines in this, and I looked at, when I read Project I as this series of regional younger people advocates, and Rory, when you're explaining it, you know, it's a great pitch, it's something we need to do. We've listened to the, you know, the Minister's removal of EMA for pathways, the struggling NEETs position that's out there, and NEETs is something that we need to tackle. And Yvonne, you've been in front of this committee a number of times about how serious we as a committee take this issue, how serious the executive take this issue. But Project I isn't scheduled to start until the middle of 2017, 2 years away. So to me that indicates that you aren't, it's not being prioritised.
We need to be mindful that we are starting with a design group to work through the outcomes of what we want to deliver. That's our starting position. This advocacy will take place as part of that, but we need to know what it is we're going to test and what the models are like first. So we need to, we're working in a sequential approach.
There's also the issue, Chair, really of resource. In an ideal world, it would be, you know, optimal to start all of these projects tomorrow. And you know, unfortunately, it's not the climate in which we're operating at the moment. So there was a need for us to prioritise the delivery of the projects within the constrained expenditure which we're having to operate.
But from the organisations and the advocates and the department already promote within NEETs and with it already sponsor within that area, is there nobody that project could be divulged to, could be given out to start now?
I think we have been very mindful in the strategy of not being over-ambitious, bearing in mind the climate we're operating at the minute, but I do have to say that I have responsibility for United Youth, and I see great scope and synergy to look at how we might look at United Youth and how some of the ambassadors from that programme could be used as advocates, single parents, people who have mental health barriers, young people. So I see great scope here indeed. I think, but for the purposes of our published document, the time frame is sequential, as I've said, and we don't really want to be running before we can walk. We need to start from the bottom up, look at the outcomes we want, open up that pre-commercial procurement in terms of allowing innovative bids right across Northern Ireland, across all the geographical areas, testing for the different groups, and then from that we weave in that advocate, and by that stage we'll have a number of advocates, for example lone parents, people with caring issues, that will be able to step up there and do that. And what we see there is that transformational communication. Look at me, here's where I came from, here's what the journey I have been on, and here's where I am now, successfully employed or playing back into their own community, or contributing back to their own community rather.
Even I don't mean to harp on about this, but it's something that has been a great focus of interest into this in this committee. You know, there was an inquiry before my time as chair. Looking at your specific timeline, which is in table papers for Project I. Sorry, I said it was going to start in April 2017, which is actually wrong. April 17, you're going to develop specific guidelines. By October 17, you'll start a pilot, but it's not until October 2019 that this will actually be rolled out to a regional basis across Northern Ireland. So we're talking 5.5 years. So the people who are that are going to be your advocates are actually still at primary school.
From our perspective, the timelines align to the entirety of all the projects, and we have them lined up in such a way. But we believe we can certainly look at that project in terms of how it will sit, but we will not have projects on the ground until 2016-17. That's the timeline that we're working to, Chair.
Okay. Wrong.
Thank you, Chair, and thank you, Yvonne and Rory, for your presentation. And I think what is important here is that you are enabling people to get back into work, and that's the key word, and that it's not compulsory and that they are trying it out. I welcome the fact that this is a bottom-up approach. I welcome the fact that no one size fits all, and that we are recognising the urban-rural dimension, and all of that will hopefully make this process far more effective. Regarding the pilot schemes, and there is concerns around the timeline, okay, but the Minister talked about trying out different interventions and seeing what works, and then whatever works then upscaling that. And I would be interested to know, could you provide any information on a particular pilot scheme that has worked for those who fall into the category of lone parents, stroke carers? Is there any information? And if you don't have it, even just to send it on, to the committee.
Certainly could forward information on specific projects in relation to lone parents, but in relation to the approach we're taking with this, I think we're all acutely aware of the issues that the groups are trying to help face, and if we knew what the solution was to addressing those issues, government would have implemented it a long time before now. So, our proposed approach is looking around the sort of the long-term impact and change in the lives of the people we would like to see, and then we want to take that sort of outcomes framework out to the market and genuinely let experts and stakeholders tell us how they think those outcomes could be met through proposals for pilot projects, which we would like to test comprehensively, first of all, through sort of feasibility studies to really bottom out what the proposals are. Because the last thing we want is to put with our, a range of vulnerable people through another series of pilot projects and subject some of them to failure through that. So we want to put as many protections in place as possible before we get down to actually testing things on the ground with the groups that we're trying to help.
And we don't have in our hands a best practice exemplar that this is about people from your community submitting a proposal for how they might engage with on a voluntary basis and what they might do to move and help and support through a range of skills development and moving them into work and looking at how we might progress them and change their world. So that's where we're starting from here, and we don't have the solution. We're actually looking for the communities and the geographical areas to say, how would you do this? And as long as we get the outcomes we want, we've no firm view on how they might do it, so to speak.
I appreciate that. Regarding childcare, can I ask what engagements you've had with OFM, DFM and DARD? Because DARD has a responsibility for rural childcare.
Certainly very conscious that OFM, DFM are developing the childcare strategy at the moment and have implemented the first stage of that through Bright Start, and that is undoubtedly one of the key structural barriers for many lone parents, and we have evidence that through our sort of engagement with them. That is an area that I expect to see some innovative ways to address that through our pilot projects by indeed some of the groups that already exist in the community that specifically help lone parents. But it is without doubt a critical barrier to employment for certainly the vast majority of lone parents that we engage with.
But have you had any engagements with OFM, DFM and DARD respectively regarding, the issue of childcare and how that feeds into the strategy?
Both departments certainly had sight of the strategy in terms of the development, and there has been some engagement, but it's something that we want to test further.
Well, could I ask, that you do provide a written update with your engagements with OFM, DFM and DARD respectively? I just would have a concern that whatever funding comes from the childcare strategy, that rural areas are getting funded here as well, because my understanding is that economic inactivity, is higher west of the Ban, rural areas, so that would be absolutely critical to this project.
We will ensure that we do that, and we will be having further engagement, and we would also be seeking, if I'm not as well, that those that are coming forward with proposals would look at joining this all up and making sure that we ensure that people from rural areas benefit from proper childcare and avail of all the support available.
There's a lot, as you rightly said, there's a lot of regional variances in terms of the profile of inactivity across Northern Ireland, and for that reason we are going to adopt a geographical approach to the projects to ensure that both urban and rural areas are given sort of adequate coverage.
Thank you.
Fran?
Sure, thank you very much, and Yvonne and Rory, thanks for the presentation. And as I said in the Assembly the other morning, you know, any move to try and deal with some of the severe difficulties we have in terms of employment has to be welcomed. And I know it's probably not easy trying to put together a strategy, because we've seen strategy after strategy after strategy, and they come to an abrupt end. And what it ends up doing is leaving a bad taste in the mouths of the people that you're trying to attract to participate in whatever working groups you may be setting up. But you spoke about expert and stakeholders. You speak about focus groups. And I'd asked a question the other morning to the Minister, and that was in around people who suffer from mental health issues. It's wide-ranging, right across the north. And what sort of efforts will be made to try and get the information that you require to allow you to deal with it? Because I noticed you meant the talk about increased support and incentives for employers, and if you could elaborate on that and what it means. But I think over the period, and the Chair sort of touched on it, over the past couple of years, we have had a number of people in here, the people from the deaf community, people from the blind and partially sighted community, who are probably amongst the worst treated when it comes to employment and things, and how you fit them in. Because I'm a great believer in partnership is a much abused word, and when people go in, they talk about we're building up this partnership, but it's usually an uneven partnership between those in authority and those that are people say that they're going to help. So I think it's crucial that if you're trying to develop a strategy, that there's an equal partnership and that people's opinions are genuinely taken on board, because there is. None of us are the experts, you know. I think out there's a wealth of experience, a wealth of expertise that if we tapped into and worked along with people, you could come up with a strategy that allows you to deal with that. Because I've met very few people that don't want to be in work, but there are particular barriers, especially in amongst that needs group, that stops people going to work. So if something could be done there. The other thing that concerned me, obviously all of us depends, it's determined by the availability of funding, and we raised that when we spoke about the United Youth, about the finance for that over the next 3 to 5 years. And it's a sort of similar thing here, that the finances is not available, or resources are not available at come to net. Is there a commitment from the other departments that if this strategy is enacted, that the resources will be found to push through?
I'm going to take your last question first, and then maybe if Rory wants to take your initial question about partnership and expertise in terms of getting support to get people back into work. And from a funding perspective, for this year, our own Minister has committed to find, to the best of our ability, the funding for our commitments for this year through the June monitoring round. And we would anticipate other departments will be expected to meet theirs in that they have signed off, the executive signed off on the strategy. Thereafter, we will be rebidding as part of the new programme for government going forward. He is firmly committed to delivering on what's in the document from our department's perspective, and we were working on that basis. You will be aware we were unsuccessful with the change fund for economic inactivity, but that said, for the pocket or for the money needed to take the design work through this year and start our preparations for projects A and B, we are proceeding on that basis.
Just in relation, Farad, to your original point, you're absolutely right. Mental health issues are, they're a huge issue in Northern Ireland, and within our our sort of work limiting health condition disability target group, which is, as you know, within the Employment Support Allowance work related activity group. I think it's around 60% of recipients of that have a psychological condition of one sort or another. So our response to that is threefold, really. I've mentioned several times the competitive pilot projects. That's going to be based on a co-design approach, where we want to listen and learn from the people that we're trying to help, as well as the groups that already do sterling work with them in the community. So that the first stages of our pilots will be about co-design. Indeed, throughout the process, it will be based on a co-design approach. You know, as I said before, government did not have the answers to this, so we need to consult and engage and genuinely listen to the people that do. In relation to the employer incentives, we want to look at a model that both supports people in the target groups to make the transition into employment, and equally for employers to create the opportunities and the job opportunities for the people to move into. And whilst we have to consider this in detail and scope it all out, certainly our Minister is very clear that any incentive that is granted to employers will be intrinsically linked to skills development for people and career progression. This is not an end result. This needs to be an evolving process where we need to help to get people the leg up, if you will, into the labour market and ensure that employers fulfil their role of ensuring an in-work skills progression and to move on and to free up opportunities for other people. And then thirdly, I mentioned sort of addressing wider barriers. You know, there are societal perceptions in relation to mental health issues. I think it's probably fair to say that there's a lack of awareness and understanding in some quarters, and we want to look at address that at a societal level through the strategy, the mental health promotion strategy that Health are taking forward, and how that will manifest itself, you know, in terms of working with employers, to how they can foster sort of mental health friendly workplaces, and just to generally promote better understanding and acceptance of mental health issues. So it's a trifold approach. First and foremost, we want to work and listen with people we're trying to help.
Sir, just a couple of wee add-ons, because I understand what you're saying in terms of the whole issue of mental health, but it's getting that moving from what you're saying into the realm of employers, and how you're able to convince them that they should be looking at the tens of thousands of people who suffer from mental health problems, who want to go into work but find it difficult because there is a bar at the employers and how you do it. But also interested in what type of incentives. And then added to that, and I know that if you're setting up groups, you would go to and rightly so, the normal groups that look after or advocates for people with mental health. But you never touched on the whole question of the blind and partially blind and the deaf community, because when they were in here, they were saying to us that yes, everybody develops strategy, but they're left out of the whole thing, and how they're included in any strategy that makes life a bit better for where they're coming from.
And we have some very good exemplar employers in that regard. There are some really good ones, and it's about how we use our project to engage with employers and link incentives to make it happen, that they are more aware of the need to employ people who are deaf, disabled, people who have hearing impairments, people who have mental health issues, and that's what part of the project will be about, linking the employer and the need to promote and widen their knowledge and their understanding, but link that to incentives as well to encourage all of that. Okay.
Rowan, very quickly on this point.
It's a separate point.
Sarah, can I come back to you?
Yes.
Then? Anna?
Thank you, Chair. A lot has been said. I think certainly economic inactivity has been a long-term problem in Northern Ireland, and with many societal layers to the problem, and unless there is huge commitment from government that government departments working together, we can have a crack on it to try to improve it. I just hope it is not going to be another academic exercise, and I hope, from it some real positive outcome will come out of it. But by going through the process, we'll probably learn, about how best to go about it. I think childcare is a big problem. That has to be cracked. The cost of childcare, when lone parents, when they added up how much it will cost them to have 2 children in getting childcare, then just doesn't pay them to go to work. I think that's something we need to certainly to look at. Just best of luck.
Thank you very much.
Okay. Claire?
Thanks, Chair. Forgive me, just to preempt what I'm about to say. This whole project strategy is based on a programme for government target, a programme for government which essentially is now out of date. 2012, so you've had 3 years to develop something like this. If I'm honest, I'm a little bit lost about what you've actually developed and what work has been done up to now. Because for me, other than, strategies and themes and projects, to be honest, which form the base of any strategy, the only thing that I'm aware of what you're doing is targeting specific groups and trying to tackle objectives that were in the programme for government anyway. So I don't really know what you have done up until now. To me, this seems like an intention to actually go out and engage with the people that you're trying to help.
Yeah, maybe, Rory, if I could let you walk through the different stages. We've been working through this as a joint departmental programme for government target, and a number of steps that we were asked to take, including developing a strategic framework. So, Rory, maybe if you want to just run through all that.
Yes, indeed. The programme for government commitment for the 11-15 period was to develop a strategy to reduce the levels of economic activity in Northern Ireland and to implement some of the key actions. That was what we were committed to do. There was a view from ministers very early on that we really needed to scope out what inactivity meant in Northern Ireland. It is a vast subject area containing a number of groups. For example, students are classified as economically inactive. There's another group, the long-term sick and disabled, which you can then break down into a number of subcategories. Ditto for family commitments, and then there's some other categories like early retirees and sort of discouraged workers. So we spent a number of months undertaking a baseline study, which put forward a number of recommendations in terms of which groups we should basically target. So there was fair degree of work went in to actually get down to the target groups that we have agreed in the strategy. We then commissioned some independent research actually to look at the profile of the target groups and to look at the kind of the profile and particularly the issues that they face and the different barriers from an individual level, such as things skills, motivation issues, confidence issues, perceptions about the world of work, through to a sort of employer level, a regional level and a national level. So we were building up an accurate picture of what the target groups look like in Northern Ireland. We then went out and engaged with people who are actually in the target groups to speak with them and to see if our understanding from the academic exercise tallied up with their real life experiences. We used that information to develop a strategic framework document at that time, and that was at the request of the executive. They wanted a framework document to be developed initially and to test it before we would embark on putting the final strategy together. So you can see already, there's a series of significant steps that we've had to work through to get to this point. We had what turned out to be, I think it was a 14 or 15-week public consultation where we took the framework out around Northern Ireland, and we talked people through it, and we met with groups and we took their views. We then had to go back into the departments and take all of the findings apart and analyse them, and to see what we moved forward with. As we were doing that, we engaged with both this committee and the ETI committee, and indeed with the subcommittee in the economy. So there was sort of ongoing updates and endorsement as we have worked through to the point where a final strategy document has been developed. And it was, has been presented to the executive over the past number of months and finally approved. So there has been a fairly extensive development process in the background of this.
I appreciate that, but the strategy that's actually been presented, I find difficulty in actually understanding what you're trying to put in place. And I mentioned this on Monday in a question to the Minister, there are no SMART objectives other than the initial, targets about 2030 and trying to meet those. So to get to this point, and you're saying to, as you've in response to other members, that we've come to a point where we need to realise that we need to go out and speak to the service users. Should we not already be there? Should we not already have their views and find out what their needs are, and actually have SMART objectives in place by this stage? Because 3 years to have an environmental analysis is quite a long time, particularly at the end of a programme for government policy. And I'm just a bit disappointed that we don't have anything a wee bit more solid here. To me, this is a very, very watery proposal from the departments, and I would like to have seen something a wee bit more concrete so that moving forward we can actually hold you to the fact that you're doing something about it. Because right now all I know is that you have a key group of people that you wish to target, and you have all this jargon about how you're going to do it, but there's nothing actually specific there.
And that's because the approach we are taking is a co-design pre-commercial procurement approach, test at a small micro level different interventions to help these groups, and that's why we are working through with an expert design group to look at the outcomes we want to obviously achieve, which are in our document, which is to help more people in these groups move seamlessly into work and stay in the world of work and be supported in the world of work, and to look at all the different barriers on their journey to doing that, all the different things members have raised today, prejudice against, for example, mental health issues, concerns for lone parents that they lose their benefits, and it needs to be a joined up, coherent, holistic approach, and we don't have the answers, so there is no benefit to us sitting in a darkened room to write a series of targets. We want to allow the community organisations to come forward and say in their area, here is what we are going to test to help lone parents from where they are at the minute into the world of work, and all we are clear about is that we'll be working through that design group to look at what the outcomes that we want to achieve as part of this. So we're working on a very different model, and I have to say I have had experience of this model through United Youth, and it works very, very well. It's very different. It is not government prescribing a series of SMART targets for what we think. These are very, very diverse and different groups, very different communities and very different geographical areas, and one size won't fit. And we would strongly contend that this strategy is the right way to go, to start at the very bottom and work your way through at a small scale and allow us to test things in geographical areas, and then we move and we upscale when we see that we work. And we're very clear what the overall target is in this. This is a 15-year strategy to really help the categories that we're working through who want to be helped to move into the world of work, and linking it to our employment targets in Northern Ireland.
I suppose beyond that, though, the only thing that I'm actually reading from this, significant document is that you want to target specific groups, and you're going to ask them how to do that. That's all I'm reading from this.
The document is intended to articulate the executive's vision to tackling inactivity over the next 15 years, and it's proposing to put in place a number of foundations, if you will, in terms of infrastructure, in terms of tackling that. As I've said it several times now, we don't have all of the answers to this, and indeed that is not a problem that is unique to Northern Ireland. This is an issue that is has prevalence across Europe and beyond. So we're trying to put in place the infrastructure and the building blocks on which we can progress and start to make inroads into inactivity. This is the first time there has been a dedicated strategy to try and tackle this issue. We believe anywhere in the UK. I think that sort of speaks volumes about the complexity and the magnitude of the issue. We're conscious that we need to work some things up in more detail. As you say, to have smart objectives, you need to know your product. Some of the things, we don't know the product yet, but we're putting in place infrastructure to allow us to get to the point where we do.
And with respect, I think that's my criticism, that you don't know your product yet. You know, after 3 years, I, to be honest, based on my limited experience and knowledge of what's happening on the ground in my own constituency, I could probably have outlined the groups that has taken you 3 years to outline yourselves. And yes, I appreciate that you need to have substance and things to back that up, but I feel this is taking too long. I'm not concerned about being the first in the UK to bring this strategy. I'm about actually seeing this working for the people that I represent, and that, we need to start getting this on the ground. And yes, it's a start, but it's a long time coming.
That's absolutely our desire as well. Subject to securing resources to take it forward.
Thanks, Chair.
Okay. David?
Thanks, Chair. Thank you, and thanks for your presentation. And probably, I know Claire maybe generalised in the document there about the whole strategy moving forward. I'd sort of maybe picked out one that you'd said, Rory, I think you're responsible for, by way of incentives. Where are we going with incentives? What are we going to do that we haven't done before? And then just picking up on your sort of the initiative here and the UK and whatnot. Have we looked anywhere at all in relation to best practice?
Just in relation to the incentives, that is a model that we will need to consider, and we'll need to balance up the needs of employers and the needs of our target groups in the context of a range of associated factors. For example, incentives that government already pays to try and achieve various things. So we'll need to strike a balance in meeting our objectives without creating a sort of internal market, if you will, in terms of the incentives. But that is a major piece of work, and that's why we've committed to undertake it via a standalone project. We have looked at best practice in a number of countries. Scotland, for example, had introduced some specific interventions aimed at helping lone parents, for example, which were quite successful. And that was something as simple as having a specific lone parent advisor in job centres. So we looked again to Northern Europe. Denmark have operated some successful schemes in terms of subsidised employment for people with disabilities. Again, there was success there. Again, it was quite costly. So whilst we have looked at other areas, it's very difficult to find a model that completely fits the profile of Northern Ireland. So where something has worked elsewhere, there's no guarantee that it will work here. And that's one of the reasons we want to test some initiatives, which may well be based on best practice elsewhere, but we want to test those on a small scale basis initially through our pilot projects to see if they actually have relevance and a similar impact in Northern Ireland. This is all about incremental development until we get to the point where we have a model we know that works, and it works on a sufficient scale to have the critical mass in terms of actually bringing down the rate of inactivity in Northern Ireland. I have absolutely no doubt that there is much sterling provision for these groups throughout Northern Ireland, but at a small scale.
Just if you're out and about in the ground at the moment, as most politicians are due to the time of year, it's a constant. I'd love to work, but it's a big but, and I don't know where you go with incentives, to be honest.
And that's why we're setting up a project, and to some degree we're trying to answer what we don't know yet, because that's what the project is charged with doing, and coming forward to test different incentives. And I think this document is about setting the vision and the direction where we're going, and each project will be coming forward with proposals and moving forward. The ones we and Dale are responsible for are obviously setting up that design group and moving forward at a pace as well with Project B, which is looking at how we might go forward to seek innovative proposals through that co-design approach. Each different aspect is a cog in the wheel, and it'll come forward with the parts and the elements it's charged with and what different models of incentivisation we might want to test, and making sure that we don't have any unintended consequences with that either, and being mindful of how we have incentivised in the past. So that's a big piece of work. It's not just something where you'll just pluck from the sky, you know, one size that'll fit and we run with it.
Yeah.
We might
It's going to
try
be some time
forward.
before all those cogs start moving together, aren't they?
Well, for this they will be, in fairness, because each department has signed off, and we will be having a steering group and a project going through a project management to take this forward.
I think the Minister mentioned on Monday during his statement, there is no quick fix solution to this. And I think, you know, we now have a commitment at an executive level to try and put the infrastructure and the arrangements in place to genuinely try and crack this on a sustainable basis.
Sydney?
Thank you, Chair, and thank you for your presentation. Obviously, the success of this strategy is going to be dependent on funding at the end of the day. If the money's not there, and I picked up that we're going to prioritise different projects or themes going forward, how will they be prioritised? How do you, out of your number of projects here, which one or who decides which one you take forward, say when money becomes, or what department takes forward? You picked them out of a hat, or what?
Sorry, each department will be responsible for delivering the elements of the strategy where they have the lead for the project. And if I could take you through the projects it sets out, and I have explained for the ones.
But will they go in tandem?
We would expect them to go in tandem, but you will look, if you look at the actual projects on page 70 and 71 and 72 and 73 of the document, they are setting out specific timeframes for when the projects will commence. For some, they are commencing from April. Indeed, the ones I've responsibility for we have commissioned work and have started on those already. For other departments, some of them will only be starting that work from April 2016, and we can only talk about what we have, the budget we have for the current executive for the period for this financial year, and thereafter a new programme for government will be that. But the executive signed off to a 15-year strategy here, so
Are you confident this will go forward on a year by year?
Well, that is our understanding, yes. Our understanding.
I hope so.
And each project will be in tandem going forward. Nothing will be left behind.
But they're all
Instead of working in isolation here, can you see this going forward as in one?
That's what the executive has committed to, and the project plan that is at the back of the strategy. Certainly, in terms of the Dell projects, you know, the chair made the point about the sequencing of we're starting some projects before others. In terms of some of the main ones, we looked very carefully at the sort of supply and demand aspect to this, and took a view that a lot of the groups we're trying to help are not yet job ready. So I think we have got a task to undertake, first of all, to start to address the potential supply chain before we look at the demand side and the demand in terms of employers and the employment opportunities. But I would like to see some crossover.
So some of the projects could be going ahead of others because some of the...
There's a sequencing. There's a sequencing.
You can't start. We need to start with the design group, and we need to start with that exercise around that pre-commercial procurement and how we go forward, and in terms of co-design and how we would then seek proposals, and sequential each project. Because you won't need an advocate till we get on the ground what it is we want to be delivering, for somebody to be brought in to share their experience and try and promote the benefits of work or how they change their lives around. But it is sequential. The projects are also.
And in terms of securing funding, you know, our priority would be to seek funding for the project we wish to start next.
Okay, John, just quickly, it's something I questioned the Minister about, is Project D in relation to employers hiring upskilled people. And I think, Roy, maybe you did touch on it. Would this be basically just a training ground, or is these going to be real jobs? If an employer is encouraged to take someone on, to upskill them, to take them out of what category they're in, and to upskill them to a certain stage, is it at the end of the day then they're offloaded and you bring someone else in? Or what is this? Are there going to be real jobs here, your focus?
That would certainly not be our intention for you know, the scenario you've just described to occur, but I appreciate that has happened previously, and you get a substitution effect, where employers are giving jobs to the individuals that come with an incentive. Those are considerations that we will be acutely aware of when we're developing the model.
We put conditions into incentivisation to make sure that doesn't happen. There's different checks and balances we can put in. We
Do
certainly
you hope employers and business would sign up to that?
The commitment would be for a genuine, sustainable job.
We've engaged with business to date, and the bottom line for the business reps we spoke to was, we're prepared to give people a chance if they have got some of the skills we need to do the jobs that we have. That was of more importance, certainly to the employers we spoke to, than a financial incentive. So again, that is, those are some of the examples of things that we will be getting into, further discussions with employers whenever we are in a position to look at that project.
Yeah, I do think there's a bit of work there to be done with employers in relation to how that works out. Okay, thank you.
William?
Thank you, Mr. Chairman. I suppose most things I've uncovered, but I don't envy your position. It's difficult. A number of difficult issues that many have mentioned, and childcare is a big issue for parents. And I think funding is a big issue because we in our business employ one guy and he's artistic. And he's full-time with us 10 years now. But without funding, he would be almost unemployable. Mm-hmm. That's probably a bit harsh, but it's fact. So in some cases, funding is necessary to get some of those people into employment. Because, their ability is, this guy's ability is probably 50% of an average person, or less maybe, But it's good for him, good for his family. And he's, he enjoys it, and funding is going to be vital in some of those cases.
One of the things I'd be very interested to see, you'd be aware of the youth employment scheme, and there's an evaluation of that underway, as far as I'm aware at the moment. And I'd be interested to see whether there's identification of a sort of a tipping point, if you will, at the point where the relationship is established between the employer and the individual. That takes a precedence, perhaps, over other support mechanisms that might have been in place at an earlier stage. Is there a particular point in an employer-employee relationship where that person becomes a more valuable asset to the organisation? So again, we're very keen to learn from experiences.
Here, and we need to be mindful of that, and I think that particular project will need to bear that in mind, and there will be different solutions and different testing in the model for the different groups, very, very different, because we need to be mindful as well. For example, we know the qualification background of our groups. Lone parents, for example, are generally quite well qualified, and those in the work limiting health condition group would have less qualifications and skills. So very different set of problems here. One size definitely wouldn't sort this out, and we need to test different incentivisation and different approaches with employers as well.
That's what makes it so difficult.
It's exactly, it's a big challenge.
Fully, yeah.
Members? Bronwyn, do you want that again? Are you okay?
No, that's okay.
Okay, Yvonne, Rory, thank you very much for your time.
Thank you.
Appreciate that. Okay, thank you. Okay, members, agenda item 12 is the Assembly Research and Information Service Special Educational Needs Bill, page 279. Members, you will recall that during our current inquiry that's going on, we were looking to see if there's any amendments could be made to the Educational Needs Bill in regard to extent and statement, and after 19 to do a piece of research. So on over to you, sir.
Thank you. As the Chair's pointed out, this briefing is based on a paper requested by the committee on a possible amendment to the Special Education Needs and Disability Bill. The request asks RAISE to consider the issues surrounding an extension to the age of special education needs or SEND provision in Northern Ireland. The briefing paper discusses the existing SEND support systems in Northern Ireland, England, Scotland and Wales, highlighting the different ways in which SEND support in education and training is provided to children and young people. As the paper provides a discussion of these factors, in this briefing I'm just going to focus on the paper's main findings and the recommendations it makes. This should take around about 10 minutes, and if the committee has any questions regarding any other aspects of the paper, I'll be happy to try and answer them at the end of the briefing. The briefing paper identifies that Northern Ireland's SEND system has remained relatively untouched since the Education Northern Ireland Order 1996, with a few amendments made via the Special Education Needs and Disability Order, or SENDO, in 2005, and Article 13 of the Further Education Northern Ireland Order 1997, which required further education colleges to give regard to the needs of people over compulsory school age who have learning difficulties. As stated in the paper, the recently published Special Education Needs and Disability, or SEND Bill, includes a clause which alters the definition of a child for the purposes of special education. The clause extends the time a child with SEND can remain in the school system to the end of the school year in which they turn 19, rather than to the end of the term as is currently the case. The Department for Education has stated that this is the correct anomaly in the current SEND legislation. As such, the SEND system in Northern Ireland focuses on pupils attending compulsory school, with FE colleges providing support to young people with learning disabilities enrolled on their courses. In England, however, provision was expanded in 2000 following the introduction of Learning Difficulty Assessments, or LDAs, under the Learning and Skills Act in 2000. This introduced an amendment to the Education Act that expanded provision for those who have left compulsory school and included a statutory duty for local authorities to carry out an assessment of needs for those under the age of 25 who appear to have a learning difficulty. As a result, support was now available for those up to the age of 25, SEND for children in compulsory schools, and LDAs for those aged 16 to 25. And SEND and LDAs are effectively the same thing, they're just at different ages. Guidance published by the Department for Education states that a local authority must continue to support the young person up to the age of 25 if they stay in further education or training. In 2014, the Children and Families Act was introduced, overhauling the existing system. Rather than separate SEN and LDA, a new Education, Health and Care Plan, or EHC plan, was introduced, and this is designed to provide support from birth to age 25, with local authorities and health bodies able to plan and commission education, health and social care activities or services jointly for children and young people with SEN or disabilities. The Act introduced a statutory duty for local authorities to make sure that services work together in promoting children and young people's well-being. The EHC plan is included within the local authority's local offer, which is a statutory publication that the local authority must publish and details in one place information on what provision people can expect within the local area. It must include information such as post-16 education and training provision, apprenticeships, traineeships and supported internships, and details on targeted services for those with SEN or disabilities who require additional short-term support. In addition, under the Act, post-16 colleges have 3 specific statutory duties. The duty to cooperate with the local authority on arrangements for children and young people with SEN, the duty to admit a young person if the institution is named in an EHC plan, and the duty to use their best endeavours to secure the special educational provisional that the young person needs. In another major difference between the NI and the English system, young people with SEN can retain their EHC plan if they are involved in certain types of work experience. This includes apprenticeships, traineeships and supported internships. And supported internships are structured study programs for young people with an EHC plan, based primarily at an employer. Internships normally last for a year and include extended unpaid work placements of at least 6 months. EHC plans can continue until the age of 25, but will stop if an individual goes to university, gets a job, tells the local authority they no longer want one, or the local authority thinks they no longer need it. Scotland retains a similar system to that in place in Northern Ireland with some variations. For example, Scotland provides for additional support needs, or ASN, rather than SEN, with ASN having a broader spectrum of support than special education needs support, including support for those being bullied, having behavioural or learning difficulties, or if they are particularly gifted. Wales currently has a similar system to that in place in England prior to the Children and Families Act, with post-16 learners in FE with learning disabilities legislated for via the Learning and Skills Act 2000, so that's similar to what's in England. However, the Welsh Government is currently in the process of developing legislation to reform the current SEN system. The new system will be similar to that in operation in England and will include a unified legislative framework to support children and young people aged 0 to 25 with additional learning needs, a term being used to replace special education needs. It should be noted that the Department of Education and the Department of Employment and Learning here have had initial discussions since the publication of the SEND on increasing the SEN age. If the committee would like to pursue an amendment to the SEND, it may wish to consider a number of issues. England has an expanded system of SEND in comparison in Northern Ireland, with its EHC plans providing support to people with learning disabilities from birth to age 25. And this has grown out of legislative development since the 1996 Education Act. As a result, England has developed a different structural system for the delivery of the EHC plans. In Northern Ireland, powers for education, transport and social care services remain largely within the remit of government departments. In England, however, these services are devolved to local authorities, although this is done under strict guidelines, these act as the main delivery agent and support structure for people with special education needs. This difference in structure means that rather than being transferred from one managing authority to another at specific transition points, the local authority remains the main source of services and funding. This reflects a statement by the Minister for Employment and Learning in response to an Assembly question in October 2014. He stated, "My department's assessment regarding those provisions falling within its own remit is that there is no direct read across the structures in Northern Ireland, and that a birth to 25 education, health and care plan of the kind supported by the Act does not sufficiently recognise and respond to the changing needs of young people as they move into adulthood." The implementation of a similar system here may require a number of amendments to the SEND. For example, the legislation governing EHC plans is based on a number of pieces of legislation and amendments, such as the Education Act 1996, the Apprenticeship Skills, Children and Learning Act 2009 and the Learning and Skills Act 2000, which have developed into the current model of support. Areas which may need amendment include the definition of a child, the definition of a young person, where statutory responsibility lies on delivery of an NI equivalent of the EHC plan, and the expansion of SEND provision to FE colleges. An alternative amendment specifically targeting an increase in SEND age may be focused on Clause 13 of the SEND. However, any increase in age provision could have a number of impacts, including on the funding for schools. For example, if the SEND age was increased to 21, instead of potentially providing support for someone with SEND for 9 years, secondary schools are providing this for 11 years. So that could have impacts on funding for the schools. Due to the extent of the reforms introduced in England currently being developed in Wales to introduce the EHC plans, a bill may be more appropriate rather than an amendment to take account of all the legislative changes necessary to not only increase the age of SEND support, but to provide for the numerous structural changes needed. As such, it is recommended that if the committee wishes to develop any legislative amendments, specialists in the drafting of legislation should be consulted. The committee may wish to contact the Department of Education and the Department for Employment and Learning regarding the progress of current discussions between officials about increasing the extent of SEND and whether this may lead to similar legislation as adopted in England and being developed in Wales. The committee may wish to contact the Department of Education and the Department of Employment and Learning for comment on any potential amendment and what impacts could occur as a result, especially in light of the ongoing budget squeezes. The committee may wish to consider the changes needed to the existing NI system in order to increase the SEND age and subsequently support the change or introduce similar provision to that provided in England via the EHC plans. And finally, the committee may wish to monitor the outcomes of the financial assessments being carried out in the Welsh Government on the cost of reform of the additional learning needs system. Thank you. Any questions? I'll be happy to try and answer them.
Okay. On you reference, it's page 301 in our packs, you know, the implementation of the knock-on effect to other pieces of legislation. If the committee was to go down this route, how difficult is that? Or is it necessary
To
amend subsequent legislation?
From taking a look at it, it depends on what the committee wants to do. If it's just an amendment to the age increase, then that would mean that your definition of a child would change. And that's,
so you could down, I think it's the Welsh have definition, they changed to definition, is it a young person they refer to?
Yeah, what they've done is under the 2000 Skills and Learning Act in England and in Wales, they introduced a definition of what a young person was, and that increased the provision from 16 to 25 within the FE colleges. So if you wanted to retain support based on what's been done in England, if you wanted to increase support of SEND provision within the FE colleges, you would need to introduce a young person's definition, and that would mean because the definition of child is focused within compulsory school.
Yeah.
So that would increase that.
That could be done as a sort of standalone.
I think there would probably be additional ones alongside that, because that's tied to the introduction of learning disability assessments, which is the equivalent of SEND into the FE colleges. But Again, it's down to the structural differences. That's based on the local authorities having control over both systems, whereas here it's divided and Dell. So
It's not a
there
big.
may potentially be knock-on effects, so it's one of those things where it's kind of
Members, any questions on this, any comment? Members, is there something, I know we've talked about through the inquiry, it's something we have talked about looking at, is looking at the options of the possibility of extending the age that is set, saying provision can be provided post-19. Is it still something we want to look at? You know, with the opportunity we've talked about, we were willing to bring in legislation. The education bill that the Minister's bringing, the Education Minister's bringing forward, does give us an avenue to do that at this stage. Is there something you want to progress?
It's true. I think if there's room for this, yes, we can make sure. Yes,
Members content, because I think one of the things we're getting from parents, I think will be up to the drafters to word that it's optional, because I think that's some of the parents were actually asking, where they were saying if their children had another 2-3 years, that would be a big benefit to them. It's not.
Sure, that's, that was a theme that was coming up, because we were asking the question, what legislative changes would you like to see? And that was one of the issues that was raised. So if there's an opportunity, we should pursue it.
Okay. Yeah.
Can we also do maybe like a cost analysis, what additional costs from the departments will be required if we extend that legislation to
Is that
25?
something you could do, or is it?
potentially we could certainly take a look at it and see if research has resources to do it. We can take a look at it and let the committee know if we can. Yeah.
You can look at what's happening in England and other jurisdictions.
Wales is doing it.
Wales is currently doing it. They're carrying out a financial assessment at the moment. There may have been, I could take a look back and see if under the previous systems, if there are cost assessments carried out, and see if there's something similar. We can take a look at it. Certainly, we can take a look and see.
Sure.
An amendment. We need to speak to the bill office.
Members, just to progress, while Owen's doing that piece of research for us as well, if Kathy, as clerk, speaks to the bills office to see what drafting would be necessary or potential. Members, I'm in your hand. Is that something we want to progress with?
Yeah.
Yeah.
Sure, how do we progress it from here?
But I think that, if Owen does that piece of research, if we speak to the bill or the drafting office to see if it's something that can be done within this piece of legislation, I think we're still scoping yet. We're not committing, but it's more to see how we do it,
Yeah.
and then see what the implications are before we do it. Would that be members content? Okay. Any more questions for Owen? Or? Okay.
Basically what I'll do is I'll go to the bill clerk and they'll have to check for us whether it's possible to do an amendment or what are the consequential amendments that need to be done to lots of different acts and whether it's viable to do it.
Yeah.
But it would be done as optional extension age up to 25. So it wouldn't be obligatory on the Education Minister to say all kids must stay to 25 or young people must stay to 25 in education. It would be optional for the
parents.
For the parents and the young people to request.
Because that's what we were getting from parents.
That they have that right
That's an
and
option.
choice.
Yeah, because some young people don't want the option to stay in school. They want to go out and get a job at 19. It's just doing an option, but it's whether it's actually possible. It depends on all the consequential amendments. If we did an amendment to this bill, what would be the effect of that on all the other bills? One has mentioned here the Education Act 96, the Apprenticeship Skills, Children and Learning Act 2009, and the Learning and Skills Act 2000. So they may all need to be changed if we do an amendment to the SEND bill. And there may be others that we don't know of as well.
Okay, might need an extra meeting.
So just for me to go ahead and scope with the bill office and see what's possible.
Okay, members content? Members, any other business?
Nope.
Okay, members, date, time and place of next meeting. Next meeting will take place Wednesday the 29th of April at 10 a.m. in room 29 Parliament Buildings. Members, we're probably looking, apart from correspondence, at one item agenda, which will be the Minister in regard to ESF and the other things. Members, can you just confirm attendance with the clerk and committee staff so they know we are going to be called for that? So Okay, members, thank you. Call the meeting adjourned.
This is the Northern Ireland Assembly Committee Room